So less than a month after the cast of Friends reunited, actor Michael Taylor, who played Gunther, revealed he was undergoing chemotherapy for prostate cancer. He was diagnosed back in 2018 and it had progressed to stage 4. He lost that battle Sunday at 59 years old. Dr. Scot Ackerman with Ackerman Cancer Center is joining us live via Zoom this morning to talk more about this. Thanks for joining us. I know it was short notice, Dr. Ackerman.
It's my pleasure. It's good seeing you this morning, Mel.
All right, so when discovered early, prostate cancer is very treatable.
Yes, it is. And most prostate cancers we diagnose today are diagnosed at a very early stage. Over 95% are diagnosed in stage 1, where it's picked up or a digital rectal examination.
Okay, so talk about those early signs of prostate cancer. What are the things that you should be looking for? And also the guidelines as far as colonoscopies for men.
Okay, so prostate cancer, when it's caught early, there's very few signs. There are some symptoms that a man might have that would lead to the diagnosis of prostate cancer. For instance, frequency of urination, maybe some pelvic pain, occasional blood in the urine. All those are signs of prostate cancer, but nearly all prostate cancers diagnosed today are diagnosed via prostate cancer screening. And prostate cancer screening is twofold. It's a digital rectal examination, and it's the blood test, the PSA, prostate specific antigen. We recommend that annually for men who are over the age of 50. And for men who are at high risk, and I can talk about that a little bit, we recommend starting that annually at age 45 or even 40 if they're extremely high risk. And the PSA test allows us to identify prostates that might have cancer in them before any symptoms are even apparent.
Let's talk about the people who are at high risk. We know African-American men are at an increased risk for prostate cancer. 1 in 7 African-American men will develop it at some point in their lifetime. What are some of those, who's the group that's more at risk? And even for African-Americans, why is that?
So there's a lot of genetics that goes with cancer. We see in breast cancer, we see a higher incidence in families where you have a mother or an aunt that's had breast cancer. Same with prostate cancer. It's a genetic thing. It happens to be with the family. So certain groups have higher instances. And as you mentioned, African Americans have a higher incidence of prostate cancer than Caucasians. In fact, the incidence in African Americans is nearly double that of Caucasians in the United States. And so African Americans are at high risk. And also people who have a first-degree relative who's had prostate cancer are at high risk. And if you're African American and you have a first-degree relative, you're considered extremely high risk.
All right, Dr. Ackerman, thank you so much. Such good information. You can get the rectal digital exam and also that PSA test, which is not invasive at all. And I think when men hear that, it certainly will make them, reach out to your doctor, especially if you're in one of those risk groups. Thanks so much for talking with us this morning.
Thank you. Have a good day.